A patient with chronic kidney disease is prescribed calcium acetate. What is the primary purpose of this medication? A. Prevent bone loss. B. Lower phosphate levels. C. Increase urine output. D. Reduce potassium levels. Answer B. Calcium acetate is a phosphate binder used to control hyperphosphatemia in patients with renal failure. Which priority intervention should the nurse take for a patient receiving 4 potassium chloride? A. Administer 4 push over 5 minutes. B. Monitor for phlebitis at the site. C. Keep the patient NPO. D. Assess for bradycardia. Answer A. For potassium should never be pushed. It must be diluted and infused slowly to avoid fatal arrhythmias. A nurse is caring for a patient with SIADH. Which lab value would you expect to find? A. Elevated serum sodium. B. Low urine osmolality. C. Hyponatremia. D. Hyperkalemia. Answer D. SIAD causes water retention and dilutional hyponatremia, not hyperkalemia. What is the first action the nurse should take if a patient begins to exhibit signs of anaphylaxis? A. Administer epinephrine. B. Apply oxygen. C. Take vital signs. D. Start 4 fluids. Answer C. Although epinephrine is the treatment, assessment, vitals is the first nursing action to guide immediate steps. Which condition is most associated with a positive Chvostek sign? A. Hypernatremia. B. Hypocalcemia. C. Hypermagnesemia. D. Hyperkalemia. Answer D. A positive Chvostek sign is indicative of neuromuscular excitability due to low calcium. A nurse is monitoring a patient on furosemide. Which finding should be reported to the provider immediately? A. Potassium 3.1 milliequivalent/L. B. Blood pressure 122/76. C. Urine output 500 milliliters in 4 hours. D. Slight dizziness on standing. Answer B. Potassium 3.1 is dangerously low and may lead to dysrhythmias. A patient receiving TPN develops shortness of breath and chest pain. What is the nurse's priority action? A. Stop the infusion. B. Elevate the head of the bed. C. Auscultate the lungs. D. Check for air embolism. Answer B. Air embolism is a risk during TPN. The priority is positioning the patient to trap air. Which statement by a patient taking warfarin requires immediate education? A. I will avoid green leafy vegetables. B. I will use an electric razor. C. I can take aspirin for headaches. D. I will wear a medical alert bracelet. Answer C. Aspirin increases bleeding risk and is contraindicated with warfarin. A patient is in the postictal phase of a seizure. What is the nurse's best action? A. Insert an oral airway. B. Provide oxygen. C. Keep the patient on their side. D. Start seizure precautions. Answer C. Positioning on the side prevents aspiration while the patient recovers. The nurse suspects digoxin toxicity. Which symptom would confirm this suspicion? A. Tachycardia. B. Visual disturbances. C. Diarrhea. D. Seizures. Answer B. A common sign of digoxin toxicity is visual changes such as seeing halos or yellow vision. Which diet is appropriate for a patient with hepatic encephalopathy? A. High protein. B. Low carbohydrate. C. Low protein. D. High sodium. Answer: C. Protein is restricted to prevent ammonia buildup in hepatic encephalopathy. A nurse is caring for a patient post-thyroidectomy. Which complication should be prioritized? A. Hypoglycemia. B. Laryngeal stridor. C. Low urine output. D. Constipation. Answer: B. Laryngeal stridor may indicate airway obstruction or hypocalcemia and is a medical emergency. A nurse is preparing to administer morphine. What should the nurse assess first? A. Temperature. B. Oxygen saturation. C. Blood glucose. D. Creatinine level. Answer: B. Morphine can depress respirations, so assessing oxygen saturation is a priority. What is the nurse's priority during a blood transfusion? A. Administer through a central line. B. Monitor for hypoglycemia. C. Stay with the patient for the first 15 minutes. D. Check capillary refill. Answer: C. The nurse must stay with the patient initially to catch any transfusion reactions early. A patient on lithium reports nausea and tremors. The nurse suspects: A. Drug resistance. B. Lithium toxicity. C. Low serum sodium. D. Normal side effect. Answer: B. Nausea, tremors, and confusion are signs of lithium toxicity, especially with low sodium. Which finding is most concerning in a patient with DKA? A. Fruity breath. B. Kussmaul respirations. C. Potassium 2.8 milliequivalent/L. D. Glucose 320 mg per deciliter. Answer: C. Hypokalemia in DKA is life-threatening and must be corrected before insulin is given. What is the priority action when caring for a neutropenic patient? A. Monitor blood pressure. B. Enforce strict hand hygiene. C. Check for pedal pulses. D. Restrict fluid intake. Answer: B. Hand hygiene is the most effective way to prevent infection in immunocompromised patients. Which of the following is a symptom of myasthenia gravis? A. Resting tremor. B. Flaccid paralysis. C. Muscle weakness that improves with activity. D. Muscle weakness that worsens with activity. Answer: D. Myasthenia gravis causes fatigue and muscle weakness that worsens with activity. What should the nurse monitor in a patient on clozapine? A. Blood pressure. B. WBC count. C. Blood glucose. D. Urine output. Answer: B. Clozapine can cause agranulocytosis, so regular monitoring of white blood cells is crucial. A nurse is providing discharge instructions to a patient with heart failure. Which statement requires further teaching? A. I will weigh myself daily. B. I can have soup for dinner. C. I will report sudden weight gain. D. I will elevate my legs when sitting. Answer: B. Soup is typically high in sodium, which can worsen fluid retention in heart failure. A nurse is assessing a client with a chest tube. Which finding should be reported immediately? A. Intermittent bubbling in the water seal chamber. B. Drainage of 20 milliliters per hour. C. Tracheal deviation. D. Gentle suctioning in the suction control chamber. Answer: C. Tracheal deviation may indicate a tension pneumothorax, a life-threatening emergency. A nurse is caring for a newborn with a positive Coombs test. What is the primary concern? A. Dehydration. B. Respiratory distress. C. Hyperbilirubinemia. D. Hypoglycemia. Answer A. A positive Coombs test indicates hemolytic disease of the newborn, increasing bilirubin risk. What is the correct action when administering ear drops to a 3-year-old child? A. Pull the pinna up and back. B. Pull the pinna down and back. C. Instill drops directly onto the tympanic membrane. D. Warm the drops by placing in hot water. Answer D. For children under 3, pull the ear down and back. Warming drops prevents discomfort. Which condition requires the nurse to implement seizure precautions? A. Hypocalcemia. B. Hypermagnesemia. C. Hyponatremia. D. Hypernatremia. Answer C. Low sodium levels can cause cerebral edema, increasing seizure risk. A nurse is reviewing lab results for a patient on heparin therapy. Which value should be monitored? A. INR. B. Platelet count. C. APTT. D. Point. Answer C. APTT is used to monitor heparin therapy effectiveness and safety. Which action should the nurse prioritize for a patient in active labor with variable decelerations on the fetal monitor? A. Prepare for delivery. B. Turn the mother to her side. C. Start oxytocin. D. Check cervical dilation. Answer B. Variable decelerations suggest cord compression, repositioning helps relieve it. The nurse is teaching a client with a new ileostomy. Which statement indicates understanding? A. I will eat high-fiber foods to reduce output. B. I will expect my stool to be formed. C. I must stay hydrated due to fluid loss. D. I will irrigate the stoma daily. Answer C. Ileostomy output is liquid, patients are at risk for dehydration. Which of the following tasks can the nurse delegate to an unlicensed assistive personnel, UAP? A. Assessing pain levels. B. Administering oral medication. C. Ambulating a stable post-op patient. D. Teaching incentive spirometry. Answer C. UAPs can assist with ambulation of stable clients, but not assessment, teaching, or meds. A client receiving methotrexate for rheumatoid arthritis reports mouth sores. What is the best response? A. This is expected. Continue your medication. B. You may be experiencing toxicity. C. You need to increase your calcium intake. D. Switch to a different toothbrush. Answer B. Mouth sores may indicate methotrexate toxicity and require immediate evaluation. A nurse is preparing to administer a live vaccine. Which client should not receive it? A. A pregnant woman. B. A client with mild asthma. C. A client with controlled hypertension. D. A child with a common cold. Answer A. Live vaccines are contraindicated in pregnancy due to risk to the fetus.